You know, so often we watch the evening news and we hear about these things that are happening in Washington, D.C., and I think most of the time we say, that's not going to impact us here back home. The impact on Sioux Falls will be minimal. That's got to be impacting somebody else, right? Yeah, in some cases that is indeed, a fair comment. But what we wanted to do today is to let the people of Sioux Falls know that there was something that just happened recently that would have had a tremendous impact on the city of Sioux Falls, and more importantly, on community health here within the city of Sioux Falls. There was this discussion about this fiscal cliff and these funding priorities that we have as a nation. And included in that was how we would fund some of these critical health care programs that we have across our great country. The CHIP program, for example, and others that Jill will talk about. What we wanted to do today was to bring us all together, not only to celebrate that we are continuing funding as a nation, at least for a brief respite on some of these community health programs, but also to help people realize right here in Sioux Falls, right here in South Dakota, just how close we were to maybe going off the cliff when it came to funding community health, taking care of those that are most desperate in need. And so again, I want to thank you for being here today to help help spread that message. And then finally, before Jill comes up, I know how hard it is to lead. I've been trying to do that here as the mayor, and I just wanted to commend our leadership team out in Washington D.C. Representative Noam, and certainly Senator Rollins and Senator Thune for helping in this effort to ensure that those that are most in need here in the city of Sioux Falls are going to get at least some needed health care, at least for a period of time. So my thanks to you as well. Now I do want to introduce you to Jill Franken. She'll go into the details in terms of just how close we were to being really dramatically impacted here in the city of Sioux Falls. Jill?
All right. Thank you, Mayor, very much, and thank you for your support of community health centers and the health department specifically. Over the past several months, as the mayor indicated, we certainly were waiting and we were wondering what the fate of this community health center funding would be for our community, for the state, and for the nation. This funding actually accounted for 70% of the total federal dollars that are granted to community health centers annually to provide the services for those that we serve. Without this funding that came so close, as the mayor indicated, to not being reauthorized, community health centers were facing significant impacts. Specifically across the country, 27 million patients are provided care at community health centers. 27 million people in our nation are provided care at community health centers. Falls Community Health is part of the Community Health Care Association of the Dakotas, and there are actually 33 communities where services are provided through community health centers. And this loss of funding accounted for about $14 million in revenue that we could have lost to South Dakota specifically, and it could have impacted around 17,000 patients just in South Dakota alone. When you look at a state like South Dakota, that's a pretty dramatic impact when you start thinking about 17,000 people. We here at Falls Community Health serve about 13,000 patients every year, and through our main site here at Falls Community Health Main, as well as 3 school-based sites at Hawthorne, Hayward, and Terry Redland Elementary Schools. What we do is we promote health by providing preventive primary care to patients who really, many of them, we are their only access point for primary care. We keep them out of the emergency rooms, and we prevent unnecessary hospitalizations through the care we provide, through the many healthcare services that we offer at Falls Community Health. And this has actually been shown to be a real economic boost to communities. You know, in small rural communities, it's an economic driver in those small communities across our state. But here in Sioux Falls alone, what we are able to do is really provide an access point for those who are uninsured but are actively working in Sioux Falls. This is really an important component for us, given, you know, the economic climate that we have in Sioux Falls, and really needing every person that's working in a job in our respective organizations to be healthy and productive and working hard at their jobs. So that's something that we take great pride in, that people that come here and receive their care are able to get the services that they need to conduct healthy lives and be productive residents of our community. You know, as the health director of Sioux Falls, though, I would be remiss if I didn't remark on, while we celebrate this restored health center funding, we do know that public health prevention funding has been decreased and continues to be heavily looked at the federal level. And we'll be closely monitoring this issue and making sure that we understand the impact to our state and specifically Sioux Falls. But this is a good week for community health centers, and it took a tremendous level of advocacy to get us here. Just a few mentions. We're grateful to our patients specifically, to our health department team as a whole. It wasn't just health center staff, but everybody in the health department that was lending their voice to this cause. To our governing board, our Falls Community Health Governing Board, and to our Sioux Falls Board of Health, to our healthcare systems who lent their voices in this effort. They understand the critical need for Falls Community Health in Sioux Falls specifically, and for the health centers across our state, that we're a vital component of the healthcare system. I want to thank our mayor and the city council for lending their voices, the governor's office as well, and our many community partners who took time to write letters, send emails, and make phone calls to our congressional delegation. And yes, ultimately, thanks to them for getting this funding passed. We're excited to finally move forward, and knowing we have funding for the next 2 years. And I hope, though, that this past 2 months has highlighted the importance of community health centers. And so the next 2 years, we must continue to tell the health center story and remain vigilant that health centers have the resource they need to do this important work as a safety net healthcare service in our community and across our state. Thank you.